Alright, I'm going to talk to you first about SIDS, inform you on some information about that. SIDS stands for Sudden Infant Death Syndrome. You may also know it as crib death. SIDS is the leading cause of death among infants from 1 month to 1 year old. Most deaths are due to SIDS. They occur between 2 and 4 months. And most infants who die of SIDS show no signs of suffering. Most of the time it occurs, most deaths due to SIDS occur in the wintertime when you put a bunch of those blankets and pillows around your baby to keep warm, and that causes overheat. Some risk factors include smoking and drinking while being pregnant, poor prenatal care, so you need to be taking your vitamins, babies who are born premature and have a low birth weight. It also occurs when mothers have babies who are younger than 20. But not only is smoking bad, but also secondhand smoke. And remember not to overheat your baby. Studies have shown that higher incidence of SIDS have occurred while a baby lying on their stomach versus their back or side. If a baby is sleeping on their stomach, it puts pressure on the child's jaw, and this narrows the airway of their breathing. So always try to keep your baby laying on its back, which is in the supine position. According to the AAP, which is the American Academy of Pediatrics, they have done a study, and since they've recommended that babies lay on their back, the rate of SIDS has dropped more than 50%. Some parents are scared that if they lay their baby on the back, that when they choke up or vomit, that they will choke on it. If your baby has any kind of issues like that or GERD, you need to consult with your doctor first before laying them on their back and seeing what's the best position for them. Keeping a baby on its side is also a bad idea because they can roll over while they sleep. If you feel that you need to have, they need to have tummy time, you need to make sure that it's best to do it when the baby is awake. Some of the AAP suggestions are: you can place your baby on a firm mattress. Never lie the baby on a pillow, waterbed, couch, chair, or any soft surface. Do not use bumper pads. It causes more of a risk for suffocation. Make sure your baby does not get warm while sleeping. Try to keep it at room temperature. Some researchers have said that if a baby gets too warm, that it can go into deeper sleep, which makes it very hard to wake the baby back up. An interesting fact is women who smoke during pregnancy are 3 times more likely to have their baby die of SIDS. And secondhand smoking doubles a baby's risk of SIDS. So make sure your baby has its regular checkups. That will help a lot. And breastfeeding if possible. Another tip is letting your baby sleep with a pacifier during its first year. This has been shown that it can lower the risk of SIDS. You do not want to sleep with a baby in your bed. You need to put the baby in the crib, and maybe the best thing for you to do is have the crib in your room. There are groups for your families who have experienced a SIDS death who can provide counseling and support. So feel free to go into any of their foundations. They will be glad to help you.